Guide go daktari Arap Koech, F Koech, Florentius Koech. Ande go daktari nebo agilit ane bongo ak spine rotetab batai. In short, ko neurosurgeon. Neurosurgeon ko chito ne kisomanchi ngalekab nerves, tigitik chebendi kundit ak tigitik chebo rotet. A daktari nebo kenyisiek chechang kiaboisie en kasit nebo neurology kongeten 2008. Kinaweke en somanet en bitonin kami Australia. Ko kinaweke konyon atau the Department of Neurosurgery in MTRH Eldoret. But TopHill go katar kenyisiek tisab. We started in 2018 up to now. And TopHill go hospitali neo nedile nen sana ngalegab brain angalegab spine. Kia boisi en hospitali se keter en emetunwek chechang kemi Japan, kemi Australia, kemi USA. Ko kinaweke ko kiamache anam service neu nikimi bitani the same standard. Amun kager biikab Kenya ko kiseretos missing kiyokto chito kwa olimbo India, olimbo South Africa for the same treatment nekimuche kenyor en Kenya. The difference kityo ko ki facilities. So kinginam TopHill make sure kele kaki equipment ak the right facilities, the right equipment. Equipment nemi hali ya juu chekure state of art. Nemuche kepiman chito kot kenai aki kele shida nenyin ko ne. Kibor kabisa kele kot ko chito nendo shida nebo brain kot ne nemi shida yoton. Kot ko spine kechungusan vizuri kot kenai aki sikinya chito komie. Yekinya chito komie and he's happy, then he'll come back because kanyor the good service. And so kikinam age make sure kele kage keep the standard nemi hali ya juu nemi barak in terms of service and care ginya jita kot kosob kot commander hospital. At the moment they workers almost 150 workers, the employees of hospital. And our care go we get a big Jabune mountain we get ter Jabuno Liba, Rwanda, Burundi, Jabuno Uganda go chang got missing, actually South Sudan. Again Kenya go no emit to Congeten Olibo Migori, Kisumu, Kisii, Kilgoris, Olibo, Narok, even Mombasa, Malindi, we see patients from all that area. So it's far and wide. How much we are keen, yani, employment, and big daktari, we look for the best. Big yangen kapsagasi nyuan. Or big passionate. Chechamagasi, among kasi ni mamaje jangia nusunuso. Maje chitara chamagasi kapsa. Because it's not about money. It's about passion. Passion ko chamet. Ne chamgasi agie any manda in the mule da to kapsa gomye. Gindai daktari sa kebunu emetunu kechanga. Amungi ko chama service. So ngono gendai consultants bali about different disciplines. About orthopedics, about gynecology, cardiothoracic, all cadres of specialists community. At the moment, we are clinic in Kericho. We are starting a clinic in Busia. We want to establish in Kisii because Pikechang, Chipundu Olibo, Nyansa Kupundu Olibo Kisii. The flagship Nenyon Nesaidi ngalega brain and spine. Not a negi gina men, or not a negi konamwen kabisa, or not a negi gicheng equipment jemiali a Jew. But of recent kogiginam other specialists. Orthopedics is now top kora, or poparagamon, kigecheng equipment in the discipline. Again, they go physiotherapy go very good. They go sabi peba alia ju, ag equipment jabi alia ju. Cardiology go ngalega mule luog. Kende go specialist na ni baraka. In neurology, kinaweken bitani ni ko kikingering kabisa. At that time when I came back we were about 7 that time, about 15 years ago. But kito kele makimuche kasit biik chetuten. Kinanyon North Rift Western Kenya koki almost the only neurosurgeon. But over time kinet biik alak, get trained in other specialists, other neurosurgeons. And I'm happy to say I've done my part, and now in Western Kenya again there are about 7 neurosurgeons, which is a big step. At the moment in total there are about 35 neurosurgeons in the country. Of course, majority go in Nairobi. Kasi niko maybe kicham cities chemi barak chemi chechang biko Nairobi. So I would say about 20 of them go based in Nairobi. There are now one in Mombasa, one in Meru. My happiness, my greatest happiness, not more than anything, more than even the monetary gains or money, more than fame. My happiness, kolanga ginya chita daga mogu muchege, agoi konyuan, komigo mnye, kwenda tego mnye, kosob chinge mnye, agobo ishe mnye. My happiness, not. So, I don't know, people like, but to me, my more of service. Kakinya chita ko sab kumye. Ako isi chike. Kwa ega sinyin. Ako tare family na nyin. Ko happiness. So jachang kikinya ako sabcha. Kot ko ek their families. Ko go no shoulder amon ki ko sabcha kumye. Nenwag chedile nen brain ak spine. Ko a wide spectrum from chegure trauma, mara kabut chita anakas accident. Sana go pick a motorbike. Amo marago man large helmets. So if they get an accident, I go abutia, and so the majority of our patients go in trauma go in humanity. The next group go infections, picanor infections, meningitis, TB, tuberculosis. TB ko giya kongwa nyenga sartage. Lakini of late, the recent years, koko gonyo barak. So gigere big kibinto shida nebo sweat, tiba rotetab amon kasi TB nebo gawe. The third group ko tumors. Tumors ko cheto cancer, ko cancerous, mi che benign tumor cancer. But all that group get tumors and growth. Chemi metit and chemi spine. So diagnosis wa sana ko ge chikil chita gomye. What we call clinical assessment. Ige choku sana yani the first thing ko kega story nebo chita gomye. In details, machonge ka se juju. Waska ge na the details care examination gomye. Thorough examination. That history a clinical examination go no the bulk of the diagnosis, almost 75%, 3/4 kena ya munga gigas history ni bachita age chagan gomye. Sige bendia cheguren radiology ane ke pirpicha ini gana ge koroti ko 25% jon a quarter gityo. So most of the things ko ke gasita ki kwa meditita for how long? Yele jita ki kwa for more than 2 weeks kwa medit kila. Ko go togel dogit negi kwa marago a tumor in the brain. Any investigation ne mi bara kabisa ko gide guren MRI, magnetic resonance imaging. Machine no ne chigile kabisa ko bar gele shida ne mi spine ne mi rotetab konne. Ibo kapsa the details ne nyalo. But the other modalities is CT scan. Usually that is the first line along kichegene ag X-ray. But today what we rely on ko MRI. Machilili magichilili amonga go toka bisa kage chekan chita gomnya age pribichai nanin not tan ne bor gomnya ne makeswa magile ne marago ne this is to be right. Ala kia mungia travel kia e matinwe kia tera And I would say machine in the Kenya MRI in me New York in terms of standard. Among these are universal equipment. Mean machine is kito magenyo ramon costs. Me machine is ko kama knife. It cost almost 500 million shillings. To magenyo to magaitat kiwango in Kenya. Such machines. Although we are getting there, I think Kenyatta University has bought one like that. But a few, I would say, majority of the things, we have the equipment. Maybe about 5%, those are the ones we sent out. In India, among them research facilities. Yeah, so the kidogo sana. In terms of training, I would say, just like at par with other places in the world. And Kike trained and big early at you at the moment. In terms of cancer treatment, we are top. And in fact, big up Kenya, Gobali Benje, Kochamata Mon Kingengele skilled, Kiki trained and gomye. Even me, Kimatawek say Kenya, because Kiachaman in a lot of we were skilled more than even the citizens of that country. So in Kenya, we have the best people. The only problem with maybe equipment, equipment among the taxes, taxes medical equipment. So we're going to need to the common man is very expensive, and that's why the cost of care in Kenya because Magi subsidizing equipment. In fact, our plea to the government, Kogi said zero rated medical equipment, but zero rated equipment. We will cheap the care. So this universal health care will be cheaper because taxes, what we are paying now, especially for equipment. Kindai patients, others go emergency, others go elective, others go today because of deficits. Until tomorrow. So those ones we have to do tonight. One kondo like Penaga Bundo Limbo Kisumu, Linda brain tumor. Go blind in one eye. I'm go blind, and tomorrow. By tomorrow, because the other eye will have gone. So that one we have to do. So the brain tumor in a very sensitive area, very deep in the brain. And so that one we have to do tonight. I go see kobun because it's fracture in the spine. So matuaugeli. Again, that's an emergency because we cannot wait until tomorrow. Yeah, I go bleeding in the brain, like when I'm go bleeding. So again, nyalogi is that clot in the brain today. So it's a number of emergencies, and we are ready. We are always on our toes because we deal with life. Life, come me time, now, unless tomorrow. By that time, got too late. So we try to save life as much as possible. Our role as a doctor got to save life, not anything else. Save life. Kingeta mapema, agiritosi late. I also teach in the medical school, so nyalo allocated time kidogo. I teach my students the new things or what I've acquired during my training. So passing that knowledge to the next generation. And then I have to be in a clinic. I'm going to be Nairobi, Mombasa, and they've made a lot of effort, flying hours going to. So we try to see them. And then after that, give an emergencies. So they're not too urgent. So we're maybe finish by very late. Success rate could change the condition about the patient. I would think how deep is it, how complicated is it. But I would say with the equipment, with technology, because success rate has improved. We have, you'll see equipment earlier, outcome and success rate going better because of trial and error. You know, it is precision. This is precision surgery. So precision almost absolute. Right, Mami, a margin of error. We are very focused, And even our equipment go focused. Among Gigi invested in the right equipment. Because I knew this is the equipment I needed. And I took again all that, and so TopHill, we are guaranteed that will give you outcome. We don't experiment on anything, we do the right thing. Oh, our facilities go branded, magibu generic chip, kagai kibu ngine akika ni northern. So there might be any complications. Medical field go rapidly changing, and diseases, technology, something about 1 week ago, changed within a week, and so we do what's called continuous education, medical education. Every so often, we meet our doctors, our team of doctors, and discuss cases. What could be anything new, can discuss, and how to. That's how we improve care of our patients. At the moment, I'm training doctors. There are even doctors, other neurosurgeons who come here for training, and as a group, we do our best to catch about the latest information, the latest technology, the latest care in the market. And so I would say our patients receive the best because we are current. Yes. Most conditions quite complicated because of late appearance. Puana bigogago chilewasa. Kiki jamara headache for 2 months, 3 months, some even up to 6 months. Akwe digita kwala Banadol. Karonge lenji brucellosis, pesoge lenji typhoid. Olanto kote time yendo. Tungo itu koki too late. So gina maja mago the early the better. Niga ski ni manini ananima right iwe daktari. Sige chikil komye sige go the right advice. Agita ke kogi negure annual checkup. I know pike chango yui ke checken maragele ga ge nyorne, but it's better ke ke nyoru ko sirge lenji now ko it's stage 4, and I think pick up college ngoma chavana gole magali saidi ke unanan lel checkup ko magali yet lene chaive agi hospitali aga to logi le machege on checkup ko tarati ene chaif kiwango fulani. So my best advice go peak to above the age of 35 years. Be it Cheviosa and Aboyot, could be testing a chatera cater, could teach Cheviosa could be children pap smear, Chinalogai, Sigisto, Kasipke Negotin day cancer never cervix. Among the biggest killer in women, co cancer never cervix. In men, the biggest killer, co cancer never prostate. And these things are possible to get mapema, or get mapema ko possible to achieve cure. Kisto, I go in the right treatment mapema. Because it to maybe 2 years down the line, Gelenji now, go in there and go it go. At that time, go too late. Yet, Kotsuke again, you in treatment, cost again, and you get cured and you continue. So, those are the things Jamacha Moji big up college. Or check and get. It's not expensive. Every year, check, annual checkup. Because anything nema me line is binyoro daktari mapema. This young lady, actually all got dark brain children. Nugo person blindness on one eye. It's a dip, yani near it comes at the brain, dip in the brain. So we are present from the side of the head, near the ear, and now all the way down. So we'll have to open the scalp to the brain. You know, positioning is everything. You get the right position so that if you're approaching the tumor, you're in the right position to get to the tumor. So everything is done meticulously, identifying the position, the side where we're going through is marked. That's how we're marked. clean, make sure it's thoroughly cleaned. After we clean it, now everybody's in place. Surgery is time good. Marago size going. Thinking the process, of the steps, what but on average, got about 2 hours today. And theater go a team, a big team, Machitage. So the head got the surgeon, the team leader, act the assistant. So there's always the assistant, and the main surgeon act the assistant, the authority. I will be the chief anesthesiologist, and agoi. So we meet him in one machine secure Kameganda, So engineers, civil machines, to control the machines to make sure a machine could be machine in the middle of the operation. That would be a disaster. So about the team, the nurses could be in patches. Me, the main scrub nurse, the scrub and authority, I have assistant in it. I could be now the run a nurse. Iaroruech I will be the ground person. Like make sure that the floor is clean, me is slippery, everything is right. Iaroruech like a messenger. Iaroruech could be any problem. So it's a big team. Big man. It's a big man on average. The floor, by start again, bacteria. Yeah. So it's not a normal flow. Okay, they with the walls. For me, any windows. And here, for is to clean air and purify and open one source. I got another source. So only in and out. Magilla didn't need any other air from anywhere else. So once I get the window, I get the doors, that's it.
Every morning, tukiingia kitu ya kwanza ni receive report ya patients. That is wenye wamekuwa na wale walifanywa surgery usiku. Our patients wenye wamefanywa surgery, kitu ya kwanza tuna assess ufahamu yao. That is wakati tumeingia tuna assess ufahamu yao. Ufahamu ya mtu wa kawaida ni 15 juu ya 15. And ufahamu ikienda chini ya patient tunachukua hatua ingine, we move to another step. Huyo mgonjwa ametoka surgery, huwa tunamconnect kwa machine kuangalia vital signs zake, that is blood pressure, oxygen na moyo kupiga. Most of them wanakuanga na shida ya pressure inaenda chini sababu maybe ame lose a lot of blood while they are at the theater. So kitu yenye tunawasaidia, tunawapea dawa ya kupeleka hiyo pressure at least iende juu. Alafu pia oxygen huwa inaenda chini. Huwa tuna supplement kuwapatia oxygen ya at least wasaidie kwa kupumua. And then kuna pain, a lot of pain, and ukifanywa surgery at that site huwa tunawapea dawa ya kupunguza machungu. Alafu kuna kutoka damu, that is bleeding. That site yenye imefanywa bleeding lazima damu itoke. Na kitu yenye tunafanya, tunatoa hiyo yenye ilikuwa imewekwa hapo, hiyo bandage, tuna dress, tunafunga na ingine. My main aim ni kusaidia patient a recover fully. Na si kila mtu ako na hiyo roho ya kusaidia, especially akiona damu, ama akiona patient ana gasp, ama akiona patient ana behave in a weird state. Sisi tuko na hiyo roho, and it's just a passion. If I see you may change, kuna vile nitakusaidia. Kama sasa akimwaga damu ama akianza kugasp, oxygen iende kwa mwili, tunakusaidia. Hatuwezi stuka. Wengine wanastuka, hata wengine wanaogopa matapishi, lakini sisi tunapanguza. Tunafanya kila kitu kama mtoto mdogo. That is our work. Kuna patient the history was alipigwa na majambazi kwa kichwa. Sasa katika harakati ya kupigwa na majambazi ikaleta bleeding ndani ya kichwa, kwa brain, kwa ubongo. Akakuja hapa akafanywa surgery ya kichwa, and most of them wakifanywa hiyo surgery huwa wanaenda wakishatoka theater, wakileta huku ICU huwa wanaenda kwa hiyo ventilator, tunaita life support machine. But he fought akuland kwa hiyo machine and akadischargiwa akaenda ward. Juzi sasa hiyo wakati ukifanya hiyo surgery unatolewa skull, ndio hiyo healing i take place. Juzi amerudi akafanyiwa inaitwa cranioplasty. Cranioplasty sasa ni kurudisha hiyo skull. Akarudisha hiyo skull and is okay, amedischargiwa leo and I'm very happy for him. Ili tu motivate kabisa. Sasa hapo penye umetolewa skull kwa inaingia ndani. Na skull hiyo tunaweka kwa theater. Inalabeliwa jina yako, everything about you. Sasa ukisha recover, they make sure you recover. Hawezi kurudisha kama uko that state yenye bado uko una recover. Mpaka urecover kabisa vizuri ndio akuja kurudishia hiyo skull.
Hospitali jiji nguni konda moetes. Kita netai kiuni moet acheket. Kokere komi clans, komi caretaker. Chito neribes kiborchini kole kiuni kole kidresseni kole akiboishe sterile gloves chetililen kabisa. Mameche uchafu age tugul amu moet ko delicate nea. Ngonyor uchafu age tugul ko nyoru chito infection. Spine nguni ingen ko bodies chebo chito. Ko very delicate. Nguni chito ang discharge kikochini positioning, sleeping position. Atyo nguni mat kwa kasi ne kimu kabisa. Mat kwa slowly. Atyo kikochini what you call TCA nguni ko return date nenyone clinic after 2 weeks. Nikisubi kiro moyo nato ko une.
Ni push daily is I always put myself in that shoe. Nasema ningekuwa ni mimi ningefanywa hivi kweli, ama ningekuwa ni relative wangu, a friend or anybody, ningefanywa hivi kweli. So wewe unanifanyia patient chenye inafaa afanyiwe tu apate kupona. So that inanipush kabisa. Yani I have that heart of empathy. Yani najiput kwa that situation that ingekuwa ni mimi kweli. That says isolate patient ni muassume ni mwache tu. Hivyo amejichafua ama oxygen imeisha ni muassume, but I always put myself, ingekuwa ni mimi. Mtu mwingine angenifanyia kweli, wacha nimfanyie data at least ajue alisaidika. Always do a check up at least 6 months. Ulifanya check up ya mwili yako. Hizi mwili si permanent. Come to our hospital, kuja tukufanyie check up from brain, mgongo, kila kitu. Alafu ningependa kutuma salamu. Ningependa kupatia shout out watu wa nyumbani huko, especially my parents Eunice and Richard Kipiego, Chembulet, Kamukono village, watu wote wa Kamukono na watu wote wenye wamesikia hii teaching. Ningependa kuwasalimia na nikwambie barikiweni, asante.
Kaida nyingo Dr. F. Koech, daktari nebo brain and spine in TopHill Hospital. Igere tetutetab tililindo en Kass TV.
Kekurenani Elizabeth Chebet. Ajone Mount Elgon. Sub-county ya Bungoma, Kapsokpony. Nijipata kumbe nimeletwa huku. Nimeshughulikiwa na Daktari Koech. Sikuwa naona, sikuwa naongea, sikuwa nafanya chochote. But nashukuru hiyo hospitali TopHill imenitoa mbali. Nimeona mkono wa Mungu kupitia kwa hiyo hospitali. Hata mimi saa hii niko sawa sawa. Ni nguvu tu but ajamage.
Ugonjwa ya Elizabeth Chebet ilianza mapema kidogo miaka zilizopita, na tukatafuta huduma kutoka hospitali mbalimbali hasa ya district, ya Kaptola na ya private. Nilipofanywa scanning ikaonekana kwamba damu ilikuwa imeingia kwa brain ndani. By then yeye hakuwa anafahamu chochote. Yeye alikuwa amekwisha kabisa, hata karibu niambie hawa muda tu refer na mtu wangu kweli amekwisha. Sababu hakuwa na chiweza, hakuwa na hata ukikuza hakuna kabisa. Alikuwa amekwisha kabisa. Tulipofika mahali hapa tukapokelewa vizuri sana na madaktari hapa, na immediately hawakujalewa. That same night akapeleka yeye kwa theater. Alipopelekwa theater, the following morning tukaambiwa muende muone wala tuende tuone kwa ICU wala ambao wamefanyiwa operation. Nilipofika kule nikaona kwamba ameanza kuongea. Nikasema Mungu kweli ameonekana mahali hapa. Mtu ameanza kuongea sio kama jana na amefanyiwa operation. Yeye sasa ndiye amepata sasa ufahamu. Akaanza kuuliza niko wapi. Asema uko hospitalini. Akaangalia, akaniuliza hospitali gani hii? Nikaambia tuko Kapsakony district. Asema hapa ni mahali pasafi zaidi. Hapa si Kapsakony, sababu anajua. Nilijaribu kumficha kidogo kwamba asijue mahali tuko, lakini alifahamu. Na nilikuwa najaribu kuingwae kwamba kama amepata ufahamu. Na ndiye akajua. Kapata ufahamu namna hiyo. Alipokuwa akipata ufahamu namna hiyo, akaanza kukula. Akaendelea kuongea vizuri, nikashukuru Mungu sana. So madaktari wamekuwa wakitutembelea. Ninashukuru sana Daktari Koech. Hata tulipokuwa kwa ward, hata hiyo ndio sababu alipotembea akatuoji, akaongea naye. Ndio nikafahamu Daktari Koech. Nikashukuru sana.
Kigureno Archdeacon Elijah Rotich. Archdeacon ko patriot ni po parish ne kigure Mosob East. Ago Archdeacon nebo Archdeaconry nebo kanyoisetab Anglican eng olimbo diocese nebo Kapsabet. Archdeaconry nebo Mosob East. Mosob East komi motwetab Mosoriot, agoi motwetab Cheptil, motwetab Kamoiwo, Kapkeringon, Chebilat, ak anyun Mosob East inendet ne ole tebe headquarters nebo Mosob East Archdeaconry. 2009 betut agenge ami pulpit ameche akoito ng'oliotab Jehova. Jale nasoman bukuit ko magere ko kakokoit anyun kole koyach ayapta kotatinding ng'onye kolechigei katestai ne. Koyach as nguni awokta Bible sikosich asoman sirutik chekakotoi komengekitu eng kanisetab Kapng'etuny All Saints, pulpit nebo Kapng'etuny eng olimbo Celia. Kobit king'wonindo nekicham komi metit orit yun neng'wan ne ngong'ololi ko kotomo atar ng'alek ko ng'wanit. Ko kingong'wanit koyoche achut koristo ne kichile serunek siachut kabisa koristo sikoyasta. Amuitoi kunotok abote biik chechang kokilen Archdeacon Rotich aya kobitani nito kochile serut, lakini kimite kito nekimite batetab nyalulnatok. Ki notok ko kingap koit kasarwek chekingichorugen eng yekiamdae pulpit ko mapetei kito nekitikin neu kisungusungu. Ki aib ko kito ne berberi, lakini kingaib ipkekono kiyoinikab konyek sikosich amuch asomane. Lakini mabek yotok. Kitestai anyun kisungusungu inotok agoi kasarta ne betut agenge ko kawe parish nebo St. Stephen's Ibanje Parish ko kakotestai eng loin ng'oliotab kisunguzungu ako ngap kasarwek alak kole ngap kurio kidogo kito nekekure charetab serunek. Kien kasarta anyun arap kurgat ko kiyokwo anyo parish nebo Mosob East nami nguno inyo anam Archdeaconry koyokwo Bishop Paul Korir nekilini Jehova kongoi mising amu tononet nebo katorchinetab kayabetab kapkorosutab kamuktendet. Kingait anyuni yekingap kakobata katororet Archdeacon nebo Mosob East kotun betut agenge mitei boisiet nebo utisiet nebo kotugul eng olimbo Pelekenya koetas kisungusunguit kai kotanam boisiet nekikong'et akochi mestowek chemengechen Lady Diet nekikure arap Saina aleji otestai anyun amu atinye kisungusungu. Betunotok awe gaa olimbo Kibulonik eng Vicarage. Ndipo mi gaa awe ko boyo kotab tupchenyu nemining nekikure Emmanuel. Kikitebi anyun eng kasaratak keng'ololi koite ale eng kamang'u abut ale tap bas koet awendo kenama anyun kokanapa Emmanuel yeitya kemutwa komutyo akoi gaa olinyunet. Kokimi tupchenyu nekure Enoch Sang konam karit nguno polishot akerwou akoi hospitalit nekikure Alpha Hill. Kingaitu Alpha Hill College Dr Kiprotich nekikakile kimeche wakati notok ameche pichainikab metit sikenai kele tos une metit. Nyokebe Eldoret Hospital keib kakweng'et nebo metit kokimong anyun kele mitei on your left hand side across nekekure tumor. Ko advice ne anyun kole chechin akoi yobe TopHill Hospital. Kecheng as kakelichigei kibendi ano len tupchoshek chu alak kibendi India. Kot kele mitei daktarindet ne managing kokoromit kora kasit eng olimbo India kimuchi kiyo konyo India nyikotoret nekekure FKH. Alenda asamache FKH notok eng Eldoret yu makebendi olimbo India. Kokiyai kasit boisiek kabisa chebo parish nekikure Mosop East. Nekondochin my Figures Warden eng Anglican ko chito nemi batetab Patriot koribe kabisa kweli kweli. Kikibwaiwe anyun boisiek chok chekilecho kong'ete kirani komwa komi as nguno ng'alek alake iyan kityo kinyain kitoretech achek nguno chekakitau keyaun boisiet. Kingenyikenyoru FKH kiro daktari netala kiro daktari ne so jamming kilen kityo Elijah utapona. Kumbe ni it's just a simple thing tutatoa na utaishi utahubiri Injili. Kile jini Jehova kongoi missing amu daktari FKH nekimuch kobwat kot missing kole nyolu keyai boisionotok kole Elijah eng betusiek 10 meche kejer within 10 days. Kikiyai kebuken anyun kotoi kobir muguleldo kidogo lebas ajidi kone lasha teacher no nguno brain surgery sokotoko sabo bas kotoi kotobot kitikin nep ko palet ande kamangunenyu Jehova itali ji kamuktenet nebo Saburi 103 nikale isabech ak inyoiweket. After 10 days tukarudi inyoko ng'alalwech as eng oret neinege hospitalitab TopHill kole kitoreti Elijah yengap kakobata osariakte oro magutik alak chemokotin eng oretab chepkondok. Wakati ne kakorikas kabisa tumdo kakimutwa kot missing alendo bas meche FKH lakini meche Dr Kiprotich kora kolecho bas ipkeweksei nyokechengane Dr Kiprotich akoi olinyinet kole akidikon chito ne toretech kabisa nguroni ko F ngotu yak F kikure F bas komakomi shida neng'ung'et kikitu koskolengu notok inyoketebi kunyanyun nguno ngoite sait aeng nebo kemboi kechortech mutyo akoi theater. Kemite theater anyun bas aleji murenik chemi yotok mukut komakitinyo akoi aro FKH mwenyewe kolejo makitinyin kabisa kolejo meche sokoit FKH taisis kidogo itu nguno alejaja kumat kotinyo ji angen ngalekwak mangen tuguk chechilu murecho sikichut mangen le kong'ete yotok manai tuguk chitestai kabisa une kakakochila jerikanuch amakituye ak FKH akoi betut nerube koitu FKH kolena Elijah habari yako umepona aleji Jehova itororo kiet boisionotok kot missing ne kienglet nyokong'ololwa anyun Dr F kolecho Elijah kibitu tumors chekimite komasi ak komasi ako anyun kiacheru kabisa tuwai koborok kale tumor nekibite komutyo over a period of time kulingana kikelach tikitik kabisa chebo itit ak konda ak tokilkilit ko kimuch kotiach komutyo nga kiting'okis nguno the cheek nerve kalat nebo konda nebo tai ak itit nebo komasi nekikose kwa umbali kulecho weksei anyun komutyo ako iwendi asi Elijah ibebeitu. Kinyatebi for 3 weeks kong'etege tarik 3 nebo arawetab January 2020 akoi tarik 21 ke discharge anyun ko kawo abunoto kerenganikyuk. Alechini Jehova kongoi missing amu ki en kasaratak anyoru kasopset nekikono asop amu ripset saet nebo Kristo amu noto kityo ripset nekiimuch koribech TopHill abwati episodes aeng chekoromen kot missing chekikaba bishops chechuket chekokiro Dr Fall Korir for the first time kingoit kele jaja makikere Elijah beteko muny kabisa ak bishopinyo bishopinik chok chekichame koto Dr Ruto nebo Eldoret nyokiwekta anyun kele makichame amu kimeche kosis Elijah amu ki enzi nekikorom kot nekibo corona. Alechini Jehova kongoi missing amu nurses che kindojini kekure Etiang chekikila karon komuso asubuhi akolen kityo Elijah tunaoga tililindo nekimi hospitali ripset ngalalet nekikonech kotatkan korangoitu daktarishek nyosojini korok eng ward nyanam eunek anyun akabirur akalechi Dr F ichek tugul chebune eunechu inya ako ingosop kiptayat mie Jehova abaibai kot asabot tupchenyu nyalunatoshek chemengechen kityo chemite konyiti Jehova mi kerichek chemengech che kikonech F cheki later on kobit some small curations akenge aeng lakini eng kerichek cheki lugui kerichot akenge kila kemboi ko kikokonech anyun keboisiechi Jehova kibotisanishei kiamdoi kirutojini Christianik kibwone nyikekere wagonjwa eng hospitalitab TopHill tos ma Jehova mano.
When I come to hospital, the first thing is go to the clinic and see the few patients that are there. We usually do rounds in the ICU between 9 to around 11, and then I'll go to the ward for ward rounds. After I'm done with the ward rounds, I'll see patients at casualty, if at all there are any patients in casualty. I usually handle general patients and filter who is supposed to see a specialist. Most cases we have here are usually brain and spine, because ideally the public know that this is a brain and spine hospital. But other than that, because the word is spreading so fast, they are usually day-to-day cases of common illnesses, especially those common colds, the stomach issues, and just infections in general. In the rainy seasons, there have been so many what we call salmonella typhi or salmonellosis. It's usually what we call in layman's typhoid. It has been so common, and I think it's because of water contamination from probably the sewerage, and also people's hygiene have not been as good. And I also think the other most common one has been something we call H. pylori. H. pylori is also due to hygiene issues, especially due to person-to-person contact after you've handled fecal matter and just contaminated food. Yeah, H. pylori. The other common illness that has been there is something called UTI, urinary tract infection, especially common in ladies. It has been so common. I think there has been a hygiene issue in general. I think the other common issue that is actually even right now is common cold, especially the last 1 week. You find that you will find 5 out of 10 patients common cold, and it's because people are abusing antibiotics. So because you find that sometimes not everyone is caught by common cold. You could be in the same room, but because depending on the age, there are different risk factors depending on the age, depending on your immunity level. So some people have more risk factors than others, and some have been abusing a lot of antibiotics, so they're easily getting these common colds and all those. There are two different instances of infections, or how infections move from one place to the other. There's something we call direct and indirect contacts. So direct is usually person-to-person contact, and that is the most common cause of infections, especially the upper respiratory tract infections, which the COVID and the common cold, they fall under. So right now you find that people stopped that aspect of social distancing. They stopped the aspect of washing their hands after, like, you know, we used to wash hands regularly during that COVID period, but people stopped practicing that. So because COVID was a pandemic and it was a new disease to us, so right now it is amongst us. It is not a pandemic anymore. Right now what we will call it, we will probably call it an endemic. An endemic is a disease that is among us and it's predictable. So you find that it's probably amongst even those clients who are coming with common colds, but we don't do tests anymore. So it's rare for us to probably see you coughing, have respiratory issues and do a COVID test, unless you're severely ill, and that's not the first thing that comes to our mind. When you have respiratory issues, the first thing that you know, common things happen commonly, especially depending on the age. If a child comes here, 2-year-old, have respiratory issues, the first thing you'll think of is pneumonia, right? Not COVID. For an elderly person, probably in his 50s, probably has other comorbidities, the first thing you'll not think is COVID. You'll think of other things like TB, bronchitis, such things. So COVID is still there, it's amongst us, but we rarely get cases of COVID because we rarely test it anymore. Typhoid is one of the biggest problems in our community, especially here in our setup. Number one, the biggest source of typhoid is hygienic issues. So you find that people don't practice hygiene issues. And hygiene issues, I don't mean by personal hygiene. Personal hygiene is very important, by, you know, self-body washing, clothes washing. But, you know, the environmental hygiene is the biggest issue. Even contact with, you know, surfaces, it's a very big problem. People don't wash fruits a lot. You'll find someone just goes to the market, takes an orange, just peels it, and then just, you know, and then people just go to the washroom, they're in a hurry, they just rush home. So the biggest issue is hygiene, because typhoid is fecal oral. Yani you've come into contact with with animal just human fecal matter. There's something called public health. So public health has three aspects. The three aspects of public health are, there is one called preventive, protective and promotive. So it's a whole long story, but now it involves everyone. It involves the government, involves the community and an individual by themselves, and also the health facilities. So number one, it is like what we are doing here, education, educating the public. So educating the public, telling them what not to do, what to do, which you said hygiene, observe your hygiene all the time. Then number two, there is what we call even isolation. You see, you find in a family someone has typhoid. So that means if he doesn't become hygienically okay, and then he's touching everything, and someone else in the family is doing the same, the other person will still get that typhoid. So isolation, when you get such a disease, you just isolate yourself until you're okay, and then everyone else is going to be safe. Because what we limit in diseases and in infectious diseases is usually spreading, outbreaks. Because now outbreaks happen because of from one person to the other, and the contact is just, there's nothing limiting the contact from one person to the other. Protective measures which the government should put in place, and also now the preventive measures. So you find that in some places actually there are vaccines for that. So vaccines are also some things that the public should be educated on, and they should be they should be easily accessible, because some of these vaccines are expensive and they are not available in especially those mashinani places, dispensaries. What I would like to talk to our young women and young men, every day in my clinic, you know, we usually advise these young people to do HIV test, and you'll find there are very new cases every day. In a span of 12 hours, if you're in a shift of 12 hours, if you get like 5 patients who are newly diagnosed, that's a lot. So in my view, it is something that we think that we've taken control, but we haven't. People are not taking seriously the ABCs, you know, abstain, be faithful, and all that. People are just spreading it, and it's silent right now. It is a very silent disease, because people are taking medication and they are looking healthy, and no one is written somewhere in their forehead that, you know, I have it. Yes. So I'd like the young people to be careful. Be very careful out here. Whatever you're doing, just be very careful and just abstain. That's the best you can do.